Sounds good? Sounds good? Check. 1, 2, 3. Everybody in?
Good morning, everyone. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. Thanks for joining us. We're here today to provide some important updates on the Omicron variant here in Santa Clara County, as well as some critical recommendations from our County Health Officer, Dr. Sarah Cody. These are community-wide recommendations. After Dr. Cody speaks to both that critical update and those community-wide recommendations, I'll be with you for a few minutes to talk about the issuance today of a limited health order requiring up-to-date vaccination of personnel in higher risk settings. But first, I'm going to turn it over to our Public Health Officer, Dr. Sarah Cody, for that Omicron update and community-wide recommendations.
Good morning, everyone. I'm Dr. Sarah Cody, Health Officer here in the County of Santa Clara, on this chilly, late December morning to give you an update on Omicron. I want to tell you where we are, tell you about some actions that we're taking, which James will detail, as well as, most importantly, our recommendations for our community in the days and weeks ahead. Since the last time we spoke, which was just less than 2 weeks ago, I warned of a deluge of Omicron, and today, unfortunately, that deluge is here. Our cases here in Santa Clara County are spiking, and the vast majority of them are Omicron. So when I last spoke with you less than 2 weeks ago on December 16th, our case rates were relatively flat. So we look at both how many new cases we have each day as well as rates. And whether you're looking at the number of cases or the rates, they've all almost tripled since the last time that I was here. So for example, we look at how many cases on average per 100,000 people per day. It was around 10 when we last spoke. It's now over 30. On the 16th, when we last spoke, we had a little over 250 cases reported that day. On December 23rd, if you look at our dashboard, you can see over 1,000 cases reported on that day. Our test positivity rate is also increasing. So far, our hospitalizations are relatively flat, but we are of course concerned about that, and the recommendations that I will share with you today and the order that James will detail for you today are really to protect our healthcare system. So we know that our healthcare system and every healthcare worker in our county and in our region have worked incredibly hard over the last 2 years to care for all of us when we get sick, whether it's COVID or something else. And our healthcare workers are a little tired, but they're still here and they're here for us. What we want to do is ensure that our healthcare workers and our healthcare system can absorb whatever hospital surge may be coming their way. Our recommendations are designed to help ensure that our healthcare system can absorb the deluge that is here now. Each of us, whether we need care for a heart attack, a stroke, a bad accident, or COVID, we need to make sure that hospitals and our healthcare workers are ready to take care of us. So even though we're all a little weary, we are asking everyone to continue to do their part. And we have a few very specific recommendations. The very first and the very most important is that everyone who has not yet gotten vaccinated, please, please, please get a vaccine. If you're 5 years old or more, the vaccines are here for you. Our sites are open and ready to take your appointment. Second, if you're 16 and up and eligible for your booster shot, get your booster shot. What we know is that protection from the initial series of vaccine, it does wane over time. Really important to get boosted and boost your level of protection back to where it needs to be to weather this surge. Second recommendation is to mask. So we're all masked even though we're outdoors because we're a little bit close together. We also recommend that at this point during this Omicron surge, that people not gather indoors unless they're masked. So if you're indoors, whatever the setting is, even if it's in your home, if you've got more than about 10 people from outside your house coming in, we really urge you to keep your masks on. Keep your masks on. Third is ventilation. We talk about these layers of prevention: vaccinate, mask, distance, boost, etc. So ventilate. Whenever possible, move things outdoors just as we're doing now, even if it's a little bit cold. Pop on your jacket, pop on your hat, move things outdoors. And when it's not possible, make sure that you're in a building with good ventilation. And then the next things, we're not mandating, but we're really strongly urging and recommending that businesses and other governmental entities also implement mandatory vaccination requirements for their staff and personnel, and make sure that everyone is up to date on their vaccines, which means primary series plus booster when eligible. For anyone who's not up to date on their vaccine for whatever reason, we recommend regular testing, and of course we recommend testing when anyone has symptoms of COVID. And finally, we recommend that any businesses that serve the public where the business requires patrons to take off their mask, for example, restaurants and bars, we recommend strongly that those businesses require their patrons to be up to date on their vaccinations before entering the business. So I've talked a lot about boosters, and I want to give you a little bit of an update of where we are with boosters, since they're so important in enabling us to weather this next patch. Our county right now, 52% of those eligible to be boosted have been boosted. For those 65 and up, and again, we're quite worried about older adults because of their greater risk of hospitalization, 67% have been boosted. Our booster demand has been steady over the last several weeks, and in our county, we do have the capacity to absorb the demand. I believe that you can get a same day or next day appointment, especially if you're willing to go to a site that may not be right near your home. You can get a booster here in Santa Clara County, and that is what we strongly recommend. So in closing, before I turn things over to James, I just want to say to our community, we are grateful for everything that everyone has done for each other over the last 2 years. I understand that we are all quite tired of this pandemic. However, the deluge is here, and we each need to take some additional steps to get us through to the other side. We've had many challenges over the last 2 years. We've been able to meet them, and I am confident that we will meet this challenge as well. Thank you.
Thank you, Dr. Cody. In addition to the strong community-wide recommendations that Dr. Cody has made, including that all employers mandate up-to-date vaccination, meaning boosters, for all of their employees, today we're issuing a health order that puts in place some limited vaccination mandates and builds on recent actions by the state health officer. So in light of the rapid increase in cases and the expected strain on the healthcare system, on December 22nd, the state health officer updated 3 state health orders that broadly require vaccination by workers in healthcare, correctional healthcare, and adult care settings, so that those orders now also require that by February 1st, workers in those settings be boosted. Today's local health order builds on these state orders by requiring that workers in these and other higher risk settings be vaccinated and boosted, that is up to date by January 24th, and that they be excluded from working in these higher risk settings if they're unvaccinated or unboosted by no later than February 1st. The local order is a limited measure that's intended to focus on protecting vulnerable populations that these workers interact with, to protect the workers themselves and their co-workers, and to ensure continuity of operations in these critical sectors as cases rapidly rise. And it expands on the state requirements in 3 important ways. It applies to a slightly broader set of workers, namely medical first responders such as paramedics and EMTs, those working in shelters, and non-healthcare staff in jails and correctional settings. It moves up the booster date to January 24th, given the importance of acting quickly. And it prohibits unvaccinated workers, including those with approved religious or medical exemptions, from working in higher risk settings altogether, effective February 1st. These workers may still be accommodated in non-higher risk settings by their employer. For the purposes of this limited mandate, the settings that we're talking about, the higher risk settings, are places where there's shared airspace or proximity with patients, clients, or vulnerable populations in skilled nursing facilities, long-term care facilities, adult daycare facilities, and memory care facilities, all healthcare delivery facilities, as well as all medical first responders regardless of where they work, jails and other correctional facilities, and all congregate shelters. Again, as Dr. Cody mentioned, over 52% of those who are eligible in our county are already boosted, but we need to get that rate much higher. Boosters are readily available, but for workers in these higher risk settings, boosters are absolutely critical given what we're facing right now, the need to ensure continuity of operations in those settings and the vulnerability of the populations that they work with. And with that, I think we're happy to answer questions.
We'll start over on this side with the Mercury News. Please identify the speaker that you wish to talk to.
Sure. This one is for Dr. Coates. Two questions, if I may. So my first is that other counties have required vaccines in places where people congregate to San Francisco or Contra Costa County. If boosters are so important in this case, why is the county not mandating vaccines in places like restaurants and bars? And then my second question for you would be, you were saying that the hospitalizations right now are relatively flat, but of course you're concerned about that. If they are flat, what are your concerns about? Where do they lie there? If at the very moment those hospitalizations are flat?
So, in answer to your question around hospitalizations, the impact on hospitals tends to lag a bit. So throughout the pandemic, first we see a rise in cases, and a bit later we see a rise in hospitalizations, and a bit after that we see a bump in deaths from COVID. So while we don't yet know exactly how the severity of Omicron compares with the severity to other variants, is that our case rates are going up incredibly fast, and some proportion of people that get sick will require a hospital bed. And so we are anticipating that our cases will exceed what they did last winter. So even a small proportion will have a significant impact on our hospitals. And that's what we are concerned about. And that's why we are trying to do everything that we can to to protect the healthcare system, so it's there to serve everyone. Regarding your questions around mandating that restaurants or other business settings require vaccination, our rates of vaccination in the county, as you know, are extraordinarily high. I believe we still may be highest rates of vaccination for a large metro area in the entire country. And the complexity now with knowing that you need to be up to date, you need to be boosted. So our feeling is that it's extremely important, but we're not taking that final step of mandating it. Our businesses have been incredibly responsible and responsive and safe with their patrons. What I would say to patrons is, for now, I would recommend patronizing your favorite restaurant by ordering takeout or delivery, by tipping a lot if you're able to support them. But gathering indoors without a mask is not the safest way to be right now with Omicron spiking as it is.
Next question, Spotlight.
Why do you think that cases will exceed last winter's numbers, especially as most of the county is vaccinated? And if you anticipate that cases will exceed the number that we saw last winter, should we anticipate any stricter lockdowns or shutdowns like we saw last winter?
Right now, where we are is in a place that's different than we've ever been in the pandemic, and I'll explain how it's different. Number one, we've had now a little bit over a year of vaccines being available. Our population is highly vaccinated. That was not true last winter. However, as we learn about the interplay between the vaccines and the variants, we also know that with Delta and now particularly with Omicron, we see a lot of breakthrough infections. Breakthrough infections with people who are vaccinated but not yet boosted. And that's why boosting is so important. Based on what we've seen about how Omicron behaves in other parts of the world and other parts of the country, it grows with breathtaking speed, a doubling time of around 2 days in many communities. When we look at our epi curve, which you can see on our website, you can see that it is shooting up. So it is likely to shoot up and go higher than it was before. And as I mentioned just a bit ago, even if a smaller proportion of those cases end up requiring a hospital bed, it could still end up being a lot of people just because the absolute number of cases is quite large.
So, sorry, did you anticipate that we'll see mandates in the same way we saw last winter then?
As I said, I think we are in a very different place than we were before. We're now 2 years in. Our community and all of us, we are equipped with tools that we did not have 2 years ago. We have plentiful, high-quality masks. Many buildings have been retrofitted and are better ventilated. We have widespread testing, we have vaccination, we have booster. So I think that what we all need to do is all use those tools, and we will be able to get through this surge.
Hi, Charles Clifford with Congregate. Just a question about testing. A lot of people do tests at home. If they come back positive, should they report that to the county? Should they get an additional test, or just stay home for a couple of weeks?
If you are ill or exposed, or for any other reason, and then you test positive, you definitely need to stay at home, isolated away from others. At this point in the pandemic, at this moment, I understand that at-home tests are difficult to come by. We have widespread testing, but sometimes it takes a little bit of work to get an appointment. So it is not absolutely critical that you get your home test confirmed with a PCR test. We do not have a way for people to report their home tests. So that brings me to an important point, which is that the cases that we see and report on our dashboard are an undercount of what's actually happening. And we understand that. It gives us a sense for the trajectory, but we know it certainly doesn't capture all the positives. And that's another reason why our focus is going to be on looking at what's happening in our hospitals, because we really need to understand the impact on our hospitals. Thanks.
And we spell that.
And Randy Roberts from the spotlight. So Congregate showed a rise in December for residents getting booster shots. Early December, December 1st, the first case was found on the variant in San Francisco, and December 10th in the county. Can you speak about the correlation between the Omicron variant and the rise in booster shots in the county?
We have seen our booster demand stay at fairly steady levels over the last several weeks. I think that the surge in Omicron has inspired many to get boosters and has kept our booster demand stable.
Thank you. The second half is, as of December 27th, it said 52.2% of residents 16 over got booster shots. But the most recent half of data, which aired on December 23rd, showed that the rate is trying to decline, possibly calling them a bell curve. And I wonder if your thoughts on that, and if the county is going to be able to improve.
I'm not hearing your question well because there's someone rolling a cart. What's the question?
So it showed that the county data, the last data entered was December 23rd, showed a decline starting, so like a bell curve in the booster shots. So I want to ask you what the county is going to do to try to continue to get people to go forward, since about half of those eligible have received a booster.
I'm not I believe that the demand for boosters has been relatively stable. Sometimes the data that's posted on the dashboard lags a bit before getting. But looking back, I think the demand has been fairly steady. We're here today to again share with the please get your booster shot if you've not done so already. Our county sites are ready to take your appointment and give you a booster.
We do have. Sorry, it's over here. Nothing.
Dr. Cody, we are already looking at a healthcare shortage of workers. Do you have any concerns that this additional mandate that healthcare workers get the booster will cause that to get even worse?
The reason for our health order is a couple points that I wanted to build on. One, our health order builds on the state's health order, which already offers quite significant protection, and we wanted to build on that further, as James mentioned. We are concerned about staffing at hospitals, long-term care facilities, skilled nursing facilities, which is why it is so very important that staff get a booster to keep them healthy and well and able to serve patients.
All right, any other questions on this side?
Dr. Cody, is it time for people to, let's say, then cancel their New Year's celebrations or gatherings?
At this point, with Omicron surging the way that it is, I would not recommend New Year's celebrations unless they are small. Small, intimate gatherings is the way to go this New Year's. It's not the time to go to a large gathering. The only exception would be if you're going to spend the entire gathering outdoors, and if you've got great outside. But it's not it's really, at this point, simply
We have just a couple follow-up before we wrap up.
Yeah,
Versus you.
just to clarify with the healthcare workers, is it just county healthcare workers, or is it everyone in the entire county?
this order applies to all healthcare workers in the county who work in higher risk settings. So that includes acute care hospitals, outpatient settings, skilled nursing facilities, long-term care facilities, and other outpatient settings such as dialysis centers, for example. All workers, correct. All workers, correct.
This is maybe a better question for Sean. So, a unique aspect of this mandate is that you're going to deny exceptions for those who are religious and medical exemptions. Do you anticipate that there'll be any backlash to that, any legal battles? And then the other question I have is, do you plan on extending this booster mandate to all county employees in the future?
Sure. So the first question has to do with the provision in the order that requires the exclusion of unvaccinated and unboosted workers from these higher risk settings. And just to clarify, it does not in any way affect an employer's ability to process and approve a religious or medical exemption, but it affects what is then done in that processing of that exemption. And so just as is true with any number of other medical conditions or other exemptions, if you can't be accommodated in that role, you have to be potentially reassigned to a different role in the organization, or the organization has to take other steps if it can. But this order says those individuals cannot work in these higher risk settings. So that'll be something that employers will have to deal with on a case-by-case basis, just as they do anyway with respect to their employees. But I just want to clarify, it's not itself saying you can't have a religious or medical exemption, but it's saying that those with an exemption can't work in these higher risk settings.
Last question, Kate, go ahead.
Do you think that this county health order will incentivize the San Jose City Council to have similar mandate?
So the question was, will this incentivize the city or other employers, including, for example, the county, going back to an earlier question? It is the strong recommendation that all employers in our community have a booster mandate for all of their employees, period, regardless of the higher risk settings. So it's a mandate in higher risk settings, and it's a strong recommendation across the board. We certainly hope that all employers in our community, including governmental entities, will move forward with doing so. And it would be my expectation that the county will follow those recommendations just like it has in the past.
All right, that's going to conclude the Q&A session. We're now going to go into the foreign language portion of the meeting. We're going to start with our Spanish speaker, Karina Herrera.
Thank you. Corina Herrera Loera, oficial de Información Pública del Condado de Santa Clara. Ahora la doctora Sarah Cody anunció que la Orden de Salud requiere vacunación actualizada para todos los trabajadores en entornos específicos de mayor riesgo del Condado de Santa Clara. La orden se basa en los requisitos de vacunación que los oficiales de salud estatales en vista del rápido aumento de casos debido a la variante Omicron. El requisito de aplicarse la vacuna de refuerzo ayudará a proteger a los pacientes y trabajadores de mayor riesgo, como centros de salud, cárceles, refugios e instalaciones de atención a largo plazo. Según la nueva orden de salud local, para el 24 de enero del 2022, los trabajadores deben estar al día con sus vacunas. Quiere decir estar completamente vacunados con la vacuna de refuerzo contra el COVID-19 si son elegibles para un refuerzo en los siguientes entornos: centros de enfermería especializada, centros de atención a largo plazo, centros de cuidado de diurno para adultos y centros de atención de la memoria, instalaciones de prestación de servicios de atención médica como hospitales, clínicas, consultorios, centros de diálisis, donde se brindan atención al paciente, así como equipos de primeros auxilios médicos, cárceles y otras instalaciones correccionales y refugios para congregarse. La doctora Sarah Cody urge a todos en nuestra comunidad que reciban su vacuna de refuerzo tan pronto como sean elegibles y sean muy cautelosos porque la variante Omicron es muy transmisible. Dice que es especialmente esencial que los trabajadores que brindan atención médica e interactúan con poblaciones vulnerables estén vacunados y reforzados para protegerse mejor a sí mismos y a las personas a su cargo. Además de exigir una vacunación actualizada en entornos de mayor riesgo, la Orden de Salud incluye importantes recomendaciones para toda la comunidad, instando a las empresas y a las personas a hacer lo siguiente. Todo el mundo debería vacunarse y recibir la vacuna de refuerzo contra el COVID-19 ahora, si aún no lo ha hecho. A menos que todos usen cubrebocas en todo momento, las personas no deben reunirse en el interior en grupos más de 10 personas que no pertenezcan a su hogar. Los empleadores deben implementar inmediatamente los requisitos obligatorios de vacunación para todo el personal que requiera una vacunación actualizada lo antes posible. Las empresas y otras entidades deben trasladar sus operaciones y actividades al exterior siempre que sea posible, donde existe un riesgo significativamente menor de transmisión de COVID-19. Cuando esto no sea posible, debe maximizar la ventilación. Las empresas que sirven al público, especialmente aquellas con actividades que requieren que los clientes se quiten el cubrebocas para participar en el negocio, por ejemplo, restaurantes y bares, deben exigir a sus clientes que estén al día con sus vacunas y muestren un comprobante de vacunación actualizada antes de la entrada. Todas las personas mayores de los 16 años que recibieron sus vacunas de Pfizer o Moderna hace 6 meses o más, o su vacuna de Johnson & Johnson hace 2 meses o más, son elegibles para una dosis de refuerzo y deben recibir una inmediatamente. Las citas para vacunas y refuerzos están disponibles en el www.sccvacuna.org. Las vacunas a través del condado no tienen costo para el público, no se requiere seguro médico y están disponibles inmediatamente independientemente de su estado migratorio. La Orden de Salud del 2 de agosto del 2021 que exige usar cubrebocas en el interior sigue vigente en todo el condado de Santa Clara. Now I'll introduce Quan, who will be doing the Vietnamese translation. Thank you.
Chào quý vị, tôi là Nguyễn Nam Cường, nhân viên truyền thông hạt Santa Clara. Thưa quý vị, trước tình hình các trường hợp nhiễm COVID-19 đang tăng nhanh do biến thể Omicron, viên chức y tế hạt Santa Clara đã ban hành lệnh y tế mới, yêu cầu mọi nhân viên làm việc trong một số môi trường cụ thể có nhiều rủi ro hơn, phải cập nhật tình trạng tiêm ngừa COVID-19. Lệnh mới này được đưa ra dựa trên những thay đổi gần đây về các yêu cầu tiêm ngừa của viên chức y tế tiểu bang, bắt buộc nhân viên trong một số ngành y tế cụ thể và môi trường chăm sóc y tế dài hạn phải cập nhật tình trạng tiêm ngừa. Theo lệnh y tế địa phương mới này, tất cả các nhân viên đang làm việc trong các môi trường có nhiều rủi ro sau đây phải cập nhật tình trạng tiêm ngừa của họ hạn chót là ngày 24 tháng Giêng năm 2022. Thứ nhất, các cơ sở chăm sóc y tế chuyên môn, cơ sở chăm sóc dài hạn, cơ sở chăm sóc người lớn tuổi trong ngày và các cơ sở chăm sóc người mất trí nhớ. Thứ hai, các cơ sở chăm sóc y tế như bệnh viện, phòng khám, văn phòng bác sĩ, trung tâm lọc máu cho thận. Thứ ba, các trại giam và cơ sở cải huấn khác. Thứ tư, các nơi tạm trú tập thể. Lệnh y tế này yêu cầu những nhân viên tuyến đầu, nhân viên quản tù và nhân viên trong trại tạm trú phải cập nhật tình trạng tiêm ngừa và yêu cầu những nhân viên chưa được tiêm ngừa đầy đủ hoặc nhân viên chưa được tiêm liều hỗ trợ phải chuyển sang làm việc trong môi trường có ít rủi ro hơn hoặc sẽ bị cấm làm việc trong môi trường có nhiều rủi ro. Ngoài việc yêu cầu phải cập nhật tình trạng tiêm ngừa trong các môi trường có nhiều rủi ro, lệnh y tế cũng bao gồm các hướng dẫn quan trọng, kêu gọi các cơ sở kinh doanh và mọi người hãy làm những điều sau đây. Thứ nhất, mọi người nên đi tiêm ngừa liều hỗ trợ và tiêm ngừa COVID-19 nếu còn chưa làm điều này. Thứ hai, trừ khi tất cả mọi người lúc nào cũng đều mang khăn che mặt. Nếu không, thì không nên tụ họp trong các nhóm có nhiều hơn 10 người không sống cùng một nhà. Lệnh y tế ban hành ngày 2 tháng 8 năm 2021 yêu cầu mọi người phải mang khăn che mặt khi ở bên trong nhà vẫn có hiệu lực trong khắp hạt Santa Clara. Thứ ba, chủ nhân các cơ sở nên áp dụng các yêu cầu phải tiêm ngừa càng sớm càng tốt cho nhân viên nào cần cập nhật tình trạng tiêm ngừa của họ. Thứ tư, các doanh nghiệp và các cơ sở khác cũng nên đưa các hoạt động và sinh hoạt ra ngoài trời khi có thể được, vì sẽ có ít rủi ro lây nhiễm COVID-19 hơn nhiều. Nếu không thể làm điều đó, thì phải làm cho không khí được thông thoáng tối đa. Thứ năm, các cơ sở kinh doanh phục vụ cho công chúng, nhất là khi có các hoạt động khách hàng cần phải tháo khăn che mặt, thí dụ như các hàng quán, nên yêu cầu khách hàng phải cập nhật tình trạng tiêm ngừa và xuất trình bằng chứng tiêm ngừa trước khi vào bên trong. Tất cả những ai từ 16 tuổi trở lên đã tiêm ngừa với thuốc của Pfizer hoặc Moderna 6 tháng trước đây, hoặc với thuốc của Johnson & Johnson 2 tháng trước đây, đều đã hội đủ điều kiện để tiêm liều hỗ trợ và cũng nên đi tiêm ngay. Quý vị có thể lấy hẹn tiêm ngừa và tiêm liều hỗ trợ tại trang mạng sccfreevax.org. Mọi người có thể tiêm ngừa miễn phí trong khắp quận hạt, không cần có bảo hiểm y tế và không có yêu cầu đặc biệt về tình trạng di trú. Quý vị cũng có thể xem thêm thông tin về lệnh y tế mới cùng với bản các câu hỏi thường gặp tại trang COVID-19 sccgov.org. Mến chào quý vị. Một lần nữa, tôi là Nguyễn Nam Cường, nhân viên truyền thông hạt Santa Clara. Next, I would like to invite Anne for the Chinese statement.
大家好，我是圣塔克拉拉县紧急行动中心的 Anne， 在此向大家宣布圣县最新的卫生命令。有鉴于 Omicron 变异病毒造成确诊病例的激增，圣塔克拉拉县卫生局长发布一项新的卫生命令，要求在某些高风险环境的工作者接种最新的新冠肺炎疫苗，也就是目前的加强剂。此命令是基于加州卫生部门规定的改变，强制要求某些医疗保健及长期护理环境机构的工作人员接种加强剂。根据最新的卫生命令，在以下高风险环境中工作者必须在2022年1月24日前完成疫苗的接种，并且接种加强剂。专业护理设施、长期照护设施、成人日间护理设施以及记忆护理设施。提供医疗保健的设施像是医院、诊所、医疗办公室、洗肾中心等等，以及医疗急救人员、监狱以及其他惩教的设施，还有集合居住的庇护所。要求全县在高风险环境中的工作者接种加强剂，并且将尚未接种疫苗和疫苗加强剂的工作人员重新分配到低风险环境的工作， 或是禁止他们在高风险的工作环境。此地方命令为大众提供了加强的保护。除了要求在高风险环境的工作者接种加强剂外，卫生命令也包括了重要的社区建议，呼吁商家及个人尽快去接种疫苗还有加强剂，不要在室内跟10人以上不同住在一起的人群聚，除非是一直戴着口罩。雇主应该要求已经接种疫苗的员工尽快的打加强剂。企业和实体应尽可能的将活动和营运移到户外，并且加强通风。为公众服务的企业，尤其是需要将口罩拿掉才可以从事的活动，像是餐厅，应该要求顾客出示疫苗卡及加强剂的接种。在今年8月颁布的室内口罩令还是持续的有效。详细的卫生命令可以上圣县的新冠网站 covid19.secc.gov.org。县府营运的疫苗站都备有免费的新冠疫苗，还有加强剂，可以上网预约，网址是 @ccfreevax.org。最后，祝大家平安健康。Next, Jim Bell will be providing a statement in Tagalog.
Magandang umaga sa lahat. Ako po ay si Jimbel Batuampo, Public Information Officer ng Santa Clara County. Ang kautusan sa pangkalusugan ay nangangailangan ng pinakabagong pagbabakuna para sa lahat ng manggagawa sa mga particular na lokasyon na may mas mataas na panganib sa Santa Clara County. Ang opisyal ng pangkalusugan ng Santa Clara County ay nagpalabas ng kautusan sa pangkalusugan na nangangailangan ng pinakabagong pagbabakuna sa COVID-19 ng mga manggagawa na nasa ilang lokasyon na may mas mataas na panganib dahil sa mabilis na pagdami ng mga kaso dahil sa Omicron variant. Ang bagong kautusan ay nagpapatibay sa mga kamakailang pagbabago sa mga kinakailangan sa pagbabakuna ng opisyal ng pangkalusugan ng Estado sa pamamagitan ng mahigpit na pagpapatupad ng pinakabagong pagbabakuna ng mga manggagawa sa ilang mga lokasyon ng healthcare at long-term care. Sa ilalim ng bagong lokal na kautusan sa pangkalusugan, sa Enero 24, 2022, ang mga manggagawa ay dapat may pinakabagong pagbabakuna. Halimbawa, parehong ganap na nabakunahan at nakakuha ng booster laban sa COVID-19 kung kwalipikado para sa booster. Sa mga lokasyong ito na may mas mataas na panganib, mga skilled nursing facility, long-term care facility, adult daycare facility at mga memory care facility. Mga healthcare delivery facility gaya ng mga ospital, klinika, medical office, dialysis center, kung saan ibinibigay ang pangangalaga sa pasyente pati na rin ang mga medical first responder. Mga kulungan at iba pang mga correctional facility at mga congregate shelter. Lahat ng lampas edad 16 na nakakuha ng kanilang mga Pfizer o Moderna na bakuna na mahigit sa 6 na buwan na ang nakaraan o ng kanilang Johnson & Johnson na bakuna na mahigit sa 2 buwan na ang nakaraan ay kwalipikado para sa isang booster at dapat kumuha nito kaagad. Bilang karagdagan sa mga pagbabakuna at booster, ang pagmamaskara, pagpapasuri, ventilasyon at pagdidistansya ay nananatiling pinakamahusay na depensa laban sa COVID-19. Ang mga appointment para sa mga pagbabakuna at booster ay available sa ccfreevax.org. Ang mga pagbabakuna sa buong county ay walang bayad sa publiko, hindi kinakailangan insurance at walang mga kinakailangan sa imigrasyon. Ang Agosto 2, 2021 na kautusan sa pangkalusugan na nangangailangan ng pangkalahatang pagmamaskara sa panloob na lugar anuman ang katayuan sa pagbabakuna ay nananatiling may bisa sa buong Santa Clara County. Ang detalyadong impormasyon sa bagong kautusan sa pangkalusugan kasama ang FAQs ay available sa covid19.scc.gov.org. Maraming salamat.